Migraines are more common than you may think, and they do affect your eyes and vision. In this episode of OCuTALK, Dr. Rudrani Banik will be telling us all about migraines, the way they impact our eyesight, and the different treatment options available. Dr. Banik?
I want to talk to you.
Not now, later.
No, now.
My name's Nick, and today we have a very special guest joining us. Please welcome Dr. Hello, everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us. Please welcome Dr. Rudrani Banik. Dr. Banik, thank you so much for joining us today.
Thank you so much for having me, Nick. It's really a pleasure to be here.
Well, it's our pleasure to have you here, and thank you for taking the time out of your day. We know you're very busy. So, Dr. Banik, before we get started on our conversation today, I was hoping if you could please just introduce yourself to our audience, let them know a little bit about your background and your specialty.
Sure. So I'm a board certified ophthalmologist, and I'm also fellowship trained in neuro-ophthalmology. And I practice in New York City, and the big city, and I have a hybrid practice. So I have a private practice, but I also teach at New York Eye and Ear of Mount Sinai. So I have a lot of my duties have to do with the education of residents, fellows, medical students, as well as I also run clinical trials there in neuro-ophthalmology. So it's a nice balance of everything between the private practice and then the academics.
Well, excellent introduction, Dr. Banik. Thank you so much again for joining us today. So, Dr. Banik, for our discussion today, we were kind of actually hoping you could discuss with us a little bit about migraines and the eyes. So to start off with, what are migraines exactly?
So a lot of people think that a migraine is just a headache, but it's so much more than a headache. It's really I like to say it's a complex neurologic condition because it's not just the head pain that happens. Many people have other symptoms, including visual symptoms that I'm sure many optometrists and ophthalmologists have dealt with. And then there are other neurologic symptoms that can happen also, but there are specific diagnostic criteria for migraine. And I'll just very briefly just review what they are. For the diagnosis, someone has to have at least 5 episodes of a very characteristic type of attack. And that's usually a headache that's one-sided, so unilateral. Usually it's a throbbing or pounding kind of headache. Sometimes people describe it as a stabbing headache. And it usually lasts anywhere from 4 to 72 hours. So this is a little different than a regular headache you may have, if you're out in the sun for too long, if you haven't had your caffeine. That headache usually is just a couple of hours and it goes away. But this headache can last longer, even up to a couple of days. And there are also associated features. So many people have light sensitivity, sound sensitivity, nausea, vomiting. So there are other symptoms that go along with the headache that are very, very classic.
And Dr. Banik, how common are migraines and why do they happen?
They are so common. I keep watching the statistics, and initially it was estimated that it affects about 8% of the population. Then the number went up to 10%. And now I think the number's up to 14% of the population has migraine, which is crazy to think. Yeah. That's, more than 35 million people in the United States, more than 1 billion people in the world have migraine. So it's one of the most common conditions, and women tend to get it a lot more often than men. So it's definitely much higher amongst women for various different reasons.
So why does it happen?
I wish we knew. There's so many different triggers that people can have for migraines, and it's really an individual reason why it happens. And many people, it's something lifestyle related. For example, dehydration, hunger, certain foods, for example, certain preservatives can trigger migraines, like fermented foods or foods that have processed ingredients like MSG or tyramine. These types of foods can trigger migraine. For other people, it's the weather. Weather patterns, changes in weather patterns can trigger migraine. And for many people, there's also an underlying feature of stress. That's kind of like the elephant in the room when it comes to talking about migraines. Stress is usually present along with all those other things kind of layered in.
Well, that's definitely excellent information, and that's an astounding statistic, actually. So thank you for that information, Dr. Banik.
It is crazy to think it's so common. It's unbelievable. Yeah.
That is unbelievable. Absolutely. And I did want a follow-up question, actually. So does it happen more in adults, or does it happen a lot in children? Is there a mixture, or do you see one more than the other?
So in my practice, and I deal with a lot of migraine patients, about 50% of my patients have migraine in my neuro-ophthalmology practice. The majority of people affected are adults, and usually migraine begins in early adulthood. Let's say your early 20s to 30s. That's usually the age range. Less commonly in older adults, but it can still happen. It can still start in one's 40s or 50s, even 60s. But usually that requires a workup. For the younger age group, children, yes, they can get migraines. Even infants can get migraines, but their symptoms are very different. So, most people who get a migraine will have some degree of headache, like I was describing, but children tend not to get the headache. And it's really interesting. They tend to get more gastrointestinal symptoms. So they'll get abdominal cramping, loose stools, bloating, vomiting. So these are some common symptoms in childhood migraine.
Wow.
Without the headache.
Yeah.
Without the headache, which is kind of hard to diagnose sometimes.
Well, definitely hard to not diagnose in infants too, who can't really explain things that are going on. So that's pretty amazing information, Dr. Banik. Thanks again. And so how does it affect the eyes, and what's the link between the eyes and a migraine?
Yeah, that's such a great question. It's also very complicated because many people with migraine have visual symptoms, whether it's visual aura, light sensitivity. Some people even have more serious symptoms. For example, a transient Horner syndrome can occur with migraine, transient vision loss aside from aura. So lots of different things can happen with the eye. And there's no, it's not well understood why there's that connection, but it has something to do with the trigeminal nerve. And we all know that the trigeminal nerve is very complex. It has many branches that go through the brain, but there are 3 branches that go to the face: V1, V2, V3. So the first division of the trigeminal tends to get irritated in migraine. So that oftentimes gives people the pain. Many people actually have pain like deep inside the eye socket. I've even had patients say the pain is so bad they wish they could just take out their eye or scoop it out. It's, can be quite severe. But then sometimes it starts behind the eye, but then it can spread. And then, so there's a trigeminal involvement there. There's also the light sensitivity component. So many people with migraine have light sensitivity. And again, we don't fully understand why this is. We think the trigeminal is involved, but probably also certain wavelengths of light, for example, blue light, can trigger migraines, or flickering lights, fluorescent lights. And we think that this may have to do with melanopsin cells in the retina. And these melanopsin cells connect deep in the brain, in the trigeminal nucleus, as well as in the thalamus. So there's some type of pain relay center there with light sensitivity and migraine. We still don't fully understand it, but what I tell patients is it's more common than not that people have that light sensitivity when they're having an attack, and maybe not even when they're having an attack. Even in between attacks, people can be very light sensitive when it comes to chronic migraine.
Fascinating information, Dr. Banik. And you may have touched on it just a little bit there, but what are like the ocular symptoms of a migraine? Like what do patients usually incur, or like when it's
so
going
one of
on?
the first symptoms is usually the migraine prodrome, which is the visual aura. So many patients come in to see their eye doctor because they've had this really strange symptom. And it's quite scary when it happens, because it starts off as a gray spot where people can't see, and then it starts to enlarge and it starts to shimmer. And it's almost like geometric patterns or a kaleidoscope. And then that takes over basically half of their vision in both eyes. And eventually it's like a C shape, and then it drifts off into the periphery. And this aura can last anywhere from 15 to 30 minutes. And people, when they first experience it, I know I've had migraine aura, and the very first time, even though I was in medical school when I had it and I knew what migraine was, I thought I was having a stroke, because it feels like you're having a stroke. There's strange shimmering in your vision, you can't see. It's really quite frightening. But luckily the aura passes, then the headache starts. That's, I would say, the most common visual symptom of migraine, aside in addition to the light sensitivity that I was talking to you about before.
Wow, that's amazing. I didn't think that was an actual, think that you're having a stroke when you're having a migraine. Like that's intense. That's crazy. So are there any preventative measures that patients can take to kind of help avoid migraines?
Yeah, absolutely. So I always start with what their triggers may be. So for many people, it could be dehydration. So I've had young, healthy people who go and have a strenuous workout in the gym and then they develop this aura and migraine. So I always ask them, were you hydrated? In most cases, they say, no, I was actually feeling really dehydrated. So I always tell people hydrate, hydrate, hydrate very aggressively to prevent those migraines. Also, a migraine brain loves to have a routine. So whatever you're doing in your daily lives, make sure it's on a particular schedule. So I always ask my patients about their sleep schedules or their meal schedules, and I tell them try to maintain a really a regular sleep schedule and a meal schedule. Try not to skip meals. And even if with sleep, I know it's hard if you're traveling, but try to have the same amount of sleep every night. Go to bed at the same time every night. Wake up in the morning the same time every day. Then food is a huge, we could have an hour-long conversation about food and migraine and how to kind of figure out what your dietary triggers may be and what you can do to eat foods that may help to reduce your migraines. So those are the standard ways that we start treatment, or I start treatment, is to talk about the things that people have in their control. And then sometimes people need treatment in terms of medications. And luckily now we have a whole armamentarium of all these great medications that work for migraine, from classic triptans to beta blockers to calcium channel blockers. And now we have CGRP inhibitors. You may have seen ads on TV, famous people kind of marketing the new migraine drugs. So there's a lot of great treatment options out there. Also, Botox can be used for migraine. But I always start with the lifestyle factors first, because I find that over 50% of my patients, if they take care of those things that are in their control, the lifestyle triggers, that they can really improve their headaches. And I should also just add one more thing. Supplements can also be really quite helpful for migraine. So specifically magnesium and B complex.
Well, fantastic information, Dr. Banik. And actually, you just brought it up just a little bit there, but I wanted to ask you, are there any like over-the-counter things that someone can go take? Like, let's say, like if I have any migraines, like I can go to CVS. If I don't have time, if I can't get to my doctor, is there anything I can take over the counter that are available in office treatments? Anything like that at your office?
Absolutely. So you can go to your local CVS and pick up, there's Excedrin migraine, which is actually a combination of a little bit of aspirin, a little bit of Tylenol, and a little bit of caffeine. And sometimes that combination will break the migraine attack. And caffeine with migraine is a double-edged sword. If you don't normally have caffeine, you can use caffeine as a treatment. But if you normally have a lot of caffeine, that caffeine may not work for you to break the migraine attack. Otherwise, you can do just Tylenol, just regular Tylenol. You can do Advil, Aleve. These are some of my favorites. And sometimes I do prescription NSAIDs as well, just to give people a little bit stronger efficacy of their NSAID. But of course, you don't want to use those drugs too often, because medication overdose can lead to other issues. Like, for example, if you take too many aspirins or NSAIDs, you can end up with a gastrointestinal ulcer. So I always tell people, if you're going to go to over-the-counter medications, no more than 2 or 3 times a week. If your migraines are worse than that and you feel like you need something more, then probably you need to be on a prescription medication.
Fantastic information, Dr. Banik. And I also did want to ask you, how does dry eye play into migraines? And is there something that we can, is eyelid maintenance a part of that? How important would eyelid maintenance be to like dry eye and to migraines?
Yeah, I'm so glad you brought that up. And actually, Nick, I should have mentioned it earlier when you were asking me about the eye symptoms of migraine. So we know that dry eye is fairly common in the population. I think about 15% of the population has dry eye. And migraine is also very common in the population. So it's no surprise that both of them can occur together. Now, whether one leads to the other, we don't really know, but there are large studies that show that people who have dry eye are more predisposed to migraine, and vice versa. So definitely, I always look for dry eye in my migraine patients, because dry eye can also cause light sensitivity. So if you have 2 issues causing light sensitivity, it can get, pretty difficult to manage. I always treat the dry eye. Of course, you want to look at the ocular surface. You want to see the quality of their tear film. You want to see if they have MGD. And treat that. So of course, you could start with lubrication, hot compresses, but also lid hygiene. And it's all really, and when warm compresses, it's all goes together, and also it's all really helpful. And I oftentimes find that my migraine patients, when I tell them to do hot compresses and the lid scrubs, they feel so much better with their light sensitivity. So sometimes even when they don't have dry eye, I still recommend doing some of those things to help with their light sensitivity.
Well, fantastic, Dr. Banik. Excellent information there. And Dr. Banik, are there any new technologies or developments on the horizon that we should be on the lookout for? I know you talked a lot about just other things that we see like on TV and everything that can help us out, but are there any new things on the horizon we should be on the lookout for?
Absolutely. So right now, medications can be used for migraine, but also there are devices called neuromodulatory devices. There's one particular device called Cephaly where people actually wear it like across their forehead, and it's believed to modulate pain along the trigeminal and along the vagus nerve. And then there are other types of devices as well. So that those, along with the CGRP inhibitors that I mentioned earlier, are really the biggest breakthroughs in migraine, I would say, in the past 3 or 4 years. But again, I think the real key is to figure out what's really causing it. And until we can really figure out what's causing it, we can't fully target our treatment. So hopefully, my hope is that within the next couple of years, we will have a better understanding of the root cause of migraine, so we can address it at the root cause rather than just to put like a Band-Aid on it with medications and the treatments that we currently have. Though they're amazing, it's great that we have them. It'll be better to treat the root cause.
Well, definitely technology is getting better, so hopefully we get to that root cause here soon. So Dr. Banik, before we leave today, was there anything else that you'd like to let our audience know about?
No, I think we covered a lot, and I want to thank you for all those amazing questions. I do provide in my social media, I do provide a lot of tips if you're interested in migraine or you have patients who have migraine and they want to get some simple tips that they can do aside from what I mentioned today. You can follow me on social media, on Instagram, Dr.Rani Banik, or on Facebook as well. I have a Facebook group called Eye on Migraine. So again, I just try to educate people as much as possible, because the more educated people they are, the better equipped they are to deal with migraine.
Well, excellent information, Dr. Banik. Thank you so much, everyone. That was Dr. Rudrani Banik. Dr. Banik, thank you again so much for joining us today.
Thank you. It was a pleasure. Thank you, Nick.